Thank you for joining us today. My name is Mike Whitmer with NCMIC, and I'm going to be moderating today's discussion. Our topic today is about the chiropractic profession's role in the Olympic Games and risk management associated with treating athletes no matter their level of competition. As the 2022 Winter Olympics in Beijing wrap up, we thought it would be a good time for us to discuss the Olympics, how chiropractors are involved, but also take a look at the risk issues involved with treating athletes, any athlete, not just elite Olympians. Many of the same lessons apply whether you're in Beijing or on the sidelines of your community high school's football game. So I'm very happy to have one of the pioneers in this area with us, Dr. Bill Moreau. Dr. Moreau is Chief Medical Officer at the University of Western States in Portland, Oregon, where he leads an interdisciplinary clinic providing high quality, whole person, integrated healthcare. Prior to his role at UWS, Dr. Moreau led sports medicine at the United States Olympic Committee as director of clinics after more than 25 years of clinical practice. Among many other events, Dr. Moreau served as Team USA's medical director at the London 2012 Olympic Games and the Sochi 2014 Olympic Winter Games, and as Chief Medical Officer for Team USA at the 2016 Summer Rio Games and the 2018 Winter Games in South Korea. Dr. Moreau founded the United States Coalition for the Prevention of Illness and Injury in Sports, which is one of 11 IOC International Centers of Research Excellence. So Dr. Moreau, thank you very much for joining us. I'm really looking forward to our conversation.
Thank you very much for the invitation. I'm super happy to be able to talk to my colleagues, and thank you to NCMIC for making this happen so we can talk about chiropractic and the world of sport.
Of course. So let's dive in, Dr. Moreau. Chiropractors have been an integral part of the Olympic Games for quite some time now. Looking at the profession throughout the 20th century, and the legislative and legal fights that chiropractors have endured, the Olympics just seems like a bridge too far. Given the struggles of the profession gaining acceptance throughout its 125-year history, how did we get involved with the Olympics?
I think that is really a great question. And the reason is, just like in real life, there's no single one person that does it all. We build together as a profession to provide opportunities. The opportunities that I was provided with were actually started at many different levels by many different doctors of chiropractic, not only in the United States, but around the world. And so while we're USA centric, there's lots of doctors of chiropractic that are involved in the Olympic movement. And also let's make sure we mention our Paralympic athletes.
Sure.
So doctors of chiropractic, I think we have some unique skills when it comes to people that maybe have asymmetry of their body. I wouldn't venture to guess who the first one was. I think that would probably be a subject of debate, but to be honest with you, that's not really the point. The point isn't who was first, in my idea, and it certainly wasn't me. The point is, how did we get there? And really, how chiropractic achieved this position in the world of Olympic sports medicine and Paralympic sports medicine is actually athlete driven. It wasn't an organization. It wasn't some board that forced their way in to get the doctor of chiropractic a seat. It's athlete driven. We, at the games that I had administrative roles in, chiropractic care was one of the most sought after services at those games. And as
By the
result,
athletes.
oh, absolutely. I never would go into a hallway and say, hey, you ought to come in and get adjusted. That just didn't happen. They would come in and I wouldn't know who they are because you don't know every athlete at an Olympic Games. But the athlete would come in and say, hey, where's the chiro? Or where's the doctor of chiropractic? And there would be more than one. Typically, in recent history, like the 80s, there was really only one doctor of chiropractic assigned only to the summer games. And then as we started to move into the 90s, there started to be a couple more and a couple more. Dr. Michael Reed from California, he was the first chiropractor at the United States Olympic Committee that was actually a full-time employee. And then I joined Dr. Reed, and then Dr. Reed moved on to do other things. I continued, and now I've moved on. And even today, I would estimate that more likely than not in Beijing, there's probably almost 24 doctors of chiropractic
Oh, really?
working. But they're working as credentialed providers. A lot of doctors of chiropractic provided very valuable services to the individual athlete. And so I'm really talking about team chiropractors with official credentials that live in the village, work in the village, are at the high performance training centers. But it's really driven solely by the athletes. You might imagine that some professions, that's a real burr in
Mm.
their sock to have these doctors of chiropractic. They prefer we weren't there. That's too bad, because even though I'm no longer a vice president at the United States Olympic Committee, I really think that chiropractic is there to stay. And the reason is, there's many, but one of the main reasons is athlete demand.
Mhm.
And in addition to that, we're a drugless profession. We don't inject, we don't sew, suture. That's not
Yeah,
what we do. Other people do that and they're really good at it. But also the instantaneous result in the human body's function as a result of chiropractic care, that's what really drives the athletes to come to us.
I see. So you were involved with working with elite athletes and being involved with the U.S. Olympic teams. I'm curious as to what your role was with the Olympic athletes.
Oh, it was really interesting. And my it's been a tremendous adventure, and one of those things that I really reflect upon, the many joys and also sorrows. When I first started out, I was a manager of the main clinic for the United States Olympic Committee in Colorado Springs. And I can remember that they knew chiropractic. And I used to maybe see, I was only supposed to treat like the top 2,000 athletes. And so if you weren't the top 2,000 or the number ones, you didn't get on my schedule.
Hmm.
And so I was supposed to basically be 70% administrative and 30% clinical and really be developing standards of care, policies, and procedures. Well, what would happen is a number one would have an appointment, say at 9:30 in the morning. So I would go out onto the clinic floor and I'd take care of that number one. And then before you know it, there's another athlete sitting on the open bay, look, waiting to be treated. I didn't even know. I introduced myself. How can I help you? Help that person. And then pretty soon another person. And then one day I had a number one. I went onto the floor to treat, and probably within 15 minutes, there were 7 or 8 athletes waiting for care. And I'm not always the brightest. And so when I finally started working through the list, I got to the last one and I said, how did you know that I was out of my office and on the floor? And the athlete said, oh, we text each other. And so to our participants in the call, I do the exact same thing you do in your office. I don't have some magic technique. I'm blessed with a really good memory, but there is no super secret special. This is the only way to do it. That's not true. It really depends upon matching up the skill sets of the doctor to the patient and their problem as they present. And so that's how come I really feel I can say with 100% confidence that the inclusion of chiropractic in the Olympic movement is 100% athlete driven. And I think we're there to stay. We may have to take a more quiet role and just be the humble servant that chiropractic has often done in many roles through the years.
Mhm.
This isn't the place where you just pound your fists and expect to be recognized. And perhaps the listeners would be interested of what it's like on the international level. It really presents a conundrum. When Team USA went to South Korea, for instance, chiropractors aren't licensed in Korea.
Oh,
It's
that's
not a
interesting.
recognized profession. And so here comes Team USA, and their chief is a doctor of chiropractic.
Yeah.
And the IOC said, what do you think about that? And I said, it's not my problem. And so they literally credentialed me as a medical physician.
Mhm.
because they didn't have a credential for me. I found that interesting.
I
Yeah.
find that interesting too. And I know that a lot of doctors that do athletic work with athletes and travel, even within the United States, there are licensure issues with that. And I hadn't thought of the issues with international travel working on the Olympic stage. So, yeah, I'm sure that did present a challenge to you.
Yeah, it's another interesting thing is that at the Olympic and Paralympic Games, there's what's called a polyclinic. And within the polyclinic is a clinic for the world. Not every nation, in fact, very few nations, are as blessed as the United States of America. We have tremendous resources that we can bring to bear. And in fact, when we go to a summer games, we ship 32 pallets by ship
Hmm.
of healthcare equipment to the games ahead of time. They have to leave 6 months ahead because they go
Wow.
by a freighter. And so people from other countries with less resources, they don't have the credentials to have a doctor of chiropractic, or maybe a doctor of chiropractic isn't even licensed in their country. Maybe they're a Division I athlete in the USA that competes for their home country. And so in the
Mhm.
polyclinic, there's doctors of chiropractic from all over the world that provide services, chiropractic services to all over the world. Once again, athlete driven at both the
Mhm.
Olympic and Paralympic Games. So right now in Beijing, more likely than not, there's a chiropractic clinic in that polyclinic that's helping to treat people from all over the world. It has been a very interesting ride to watch the IOC and the IPC, the International Paralympic Committee, manage to the challenge of athlete demand for chiropractic care around the world.
Sure. So, working with elite athletes, of course, there's a lot of reward to that for the athlete, of course, for the doctor. I'm sure it's a great experience and very gratifying. But there's risk too. What does risk management look like on the Olympic stage? I'm thinking of all the things that I constantly preach: documentation, exam history, all of that stuff. But now you're in this pressure cooker world of the Olympics. What does risk management look like there?
Yeah, I think that's a really interesting question because obviously the policy has to cover more than chiropractic care because we're super safe.
Hmm.
But when you start to include the medications, the injections, all of this gambit, and also the level of the patient that you're working on and the
Right.
potential downside if there's a mistake to that individual for real harm financially, physically, everything else. So, one, there's a really solid policy in place to
Mhm.
help us. But on the other side, how do we mitigate that? Through standard of care documents.
Okay.
And,
So, so
clearly,
there is documentation
oh,
on the athletic field.
oh, and that documentation is specific to the United States. For instance, I think that everybody on the call, if you love Olympic sport, we all know who Larry Nassar is. Okay, so he was a terrible individual
Hmm.
who sexually abused hundreds of young people. And so how do you prevent that in the future? One of the
Right.
ways is through standards of care. So for whether you're working at the Olympic level or whether you're working at a local high school in middle America, whenever you're working somebody, especially of the opposite gender, not that's the only way that that may occur, but especially with a minor, especially in one of the areas that are more sensitive, such as the pelvis, anterior chest, or those types of things, you have to make sure, number one, you even have permission to do, and maybe it's something that's super legit. You need to do some myofascial work to the upper lateral pec that's on the anterior chest wall. And so you need to have a chaperone, you need to have a drape, you need to have permission before you touch that person. And in addition to that, patient athlete interaction has to be what's called observable and interruptible, meaning that interaction must occur in a place where anybody walking by could casually look and see what's happening. And if there was a problem, they could just step right up and say, wait a second, I don't think that's right what you're doing. So that's one of the examples that's resulted in a $250 million plus settlement. And so that's a real example of risk management at the Olympic level.
Yeah. I'm glad to hear this because it sounds like a lot of what we put out there for risk management in the Main Street chiropractic office applies to treating elite athletes as well. There are standards of care. There's documentation that needs to be done. You need to have know the patient, all those same risk management issues that we have in daily practice apply on the Olympic stage as well.
Yeah, you're absolutely right. And for all of the doctors involved in sport, which I would venture to say every doctor at chiropractic works with athletes,
Mm-hmm.
and the athlete might be a 86-year-old individual who plays golf. It doesn't matter. But the point is, I think that before you treat the athlete, especially when you consider the majority of people in sport are under the age of 18, at
Sure.
an AAU event, a middle school event, a high school event, you better make make really sure that you actually have permission to treat that individual. Just because you're at a basketball game and the point guard takes a hard charge and injures their sacroiliac joint, and during halftime the coach says, hey, can you take a look at that? There's a big difference between first aid, urgent care, and providing manipulative therapy in the sporting arena without that individual doesn't have permission to give you permission to treat them. Only their guardian does.
Yeah.
And while the athlete may want it, and you will want to help that athlete, if that athlete's guardian or parent does not say that's okay, it's not okay.
Got it. Doctors of chiropractic are getting more involved with athletes and teams all across the country, not just Olympians, because it really is a good natural fit for what they do. But there's a lot more to it than hanging out on the sidelines during an athletic event. What are the responsibilities of a team doctor? And we've talked about some of them, standards of care, documentation, that sort of thing. But if I'm a doctor and I'm looking at working with my high school football team, what are some of the responsibilities that I need to be aware of?
That's a really good question, because the longer you do it, the more you learn what the expectation is. And so let's say that first, let's talk about what's the difference between a sports chiropractor and a team physician.
Sure.
We're all sports chiropractors. We're chiropractors who take care of people involved in sports. Could be as simple as that. A team physician is an individual, or a team chiropractor is more likely than not going to have an agreement with an organization. So once to the individual level, the team is more at an organizational level.
Sure.
And so the art of the individual's actually long-term success at that level is to recognize what's your role on the team. It's very possible you're the solo person. There is no other team. You are the team. The duties and responsibilities are much different than for that individual than an individual who works in a professional league or at a Division I school, where they have all different kinds of healthcare providers on the sideline with very specific roles. So the doctor of chiropractic's role could be as simple as, I look at spines, to I manage life-threatening emergency. And so the doctor would be very astute to look at the situation before they accept, and make sure they have the prerequisite training to evaluate and manage sports-related concussion, pneumothorax, acute
Mm.
subdural bleeds if they're by themselves, joint dislocations, joint fractures, application of emergency oxygen, selection of airways, versus I'm here, there's other people here to take care of that stuff. My job is to do chiropractic. Big difference, and you need to know that before you engage.
Sure. And I would imagine that every situation is probably different. What one high school may want from a chiropractor that wants to get involved with their teams versus what a neighboring community school district may need could be completely different. It's on the doctor to evaluate the situations, understand their responsibilities, and make sure that they're prepared to accept those.
Absolutely. You have to also look for the opportunity. I believe there's a lot of doctors that would like to get engaged with the team, but
Absolutely.
maybe you feel prevented from engaging. Don't just keep on trying to do the same thing and expect a different result. What you have to do is determine what is your value package, not to you, but to the team. What do
Yeah,
you bring to the team that's going to help that athlete or that athletic team be able to perform better, be able to prevent injuries, be able to have a healthier team? That's the question that you must fundamentally ask. And the answer to the question is typically different in each setting, maybe even in the
sure.
same community.
Okay. So, following up on the risks involved, what are some of the pitfalls that doctors need to be aware of and manage?
There's quite a laundry list there.
I'm
One of
sure, I'm sure.
it's really important to understand, just because it's called sports medicine or sports chiropractic, it doesn't matter. It's still healthcare. You
Right.
have to stay within your scope of practice. And the interesting thing is, which scope of practice do you use if you cross state lines? I'm talking to you today from the state of Oregon, which has a very broad scope of practice. However, when I go home in about 5 minutes, I can drive across a bridge and I'm in the state of Washington, a completely different scope of practice. Typically, in the eyes of the law, I believe that the scope of practice that you use is the scope of practice of your home state, and your care is restricted to your team. If your
Okay.
volleyball team goes from Portland to Vancouver and you're going to take care of that volleyball team, you can do what you do. However, let's say that the coaches are friend and they say, "Man, your chiropractor is awesome. Could they take a look at my patient?" That's a whole different ballgame, because
Oh,
that
yeah.
person isn't part of your cohort from your home state. So that would be one, making sure you stay within the standard of care. Also, an odd one in sports is concealing medical information. So
Okay.
you get so wrapped up in the team that you actually think that you're going to drive the result of the contest. I know that sounds stupid, but it happens. And the patient may have a condition that should perhaps preclude them from participation, but you don't tell the patient. That's concealing medical information.
I
A
see.
more common one is a negligent failure to monitor an injured athlete. You're there, an athlete takes a blunt trauma blow to their abdomen. You check them out initially and they seem pretty good, but you don't do serial or repeat examinations. And it turns out that individual actually had an injury to an internal organ that you did not detect because you did not monitor the status of the athlete.
Mm,
That would be one. The pre participation physical is a big one. How often are we litigated against? I really couldn't tell you, but I think it's pretty rare. But nevertheless, you have the responsibility to meet the standard of care to perform the PPE. And Mike, perhaps the audience might be interested in knowing, I believe in some cases, if you hold yourself out as a quote team physician,
mm.
you will be held to a higher standard of care than saying I'm the chiropractor or I'm the doctor of
Yeah.
chiropractic.
Yep.
Because if you say you're the physician, you could potentially be held to the standard of care of what we would typically consider an allopathic physician. So
Yeah.
those are a couple things that just pop into my mind.
Yeah. Yeah. And that is true. And we see that in other areas of chiropractic practice too, that if you assume that role, that is the standard that you'll be held to. Definitely could see that applying here. Yeah. Let's get into this a little bit deeper because this is, I find this very interesting when you say that sometimes doctors start thinking that they can determine the outcome of the contest. I would think that return to play decisions after an injury on the field, I would think that those would be really difficult because you have an athlete that wants nothing more than to get back into the game, but getting back into the game could be incredibly dangerous for them. I'm thinking concussion and things like that.
Yes.
What does a return to play decision look like?
Mike, I want to thank you for asking that question, because before you engage on the field management, you have to understand the return to play workflow, you might say. Okay, so the gold rule is the health of the athlete comes first before all other considerations. I only have one quote I've ever made, and that's, you need to know what you need to know before you need to know it in sports medicine. In other words, if you're going to do a return to play on a head injury, you better know what that looks like. And in fact, for the doctors, just know this: if you suspect an athlete has a concussion, they may not return to play that same day.
Mhm.
And so when you make the return to play decision, you have to, there's many things you have to consider. Number one, do you have a definitive diagnosis? In other words, do you actually know, really know what's wrong with your patient? Number two, is the presentation static in its presentation, the clinical presentation? Is your patient changing? Is there signs and symptoms evolving? Never return people to play until they're static in their presentation. Then do they have the ability to do the things they need to do in their sport? Is their range of motion normal, near normal? Is there no signs of neurologic injury? Is the joint stable? And really one that you might not think of, is the patient psychologically ready to return to play?
Mm.
One of the last things you do is you look the patient in the eye and say, do you want to go back in? And if they drop their eyes and say yes, that patient doesn't, they're not
Mm.
ready. And so for each specific injury, there's a multitude of considerations that have to be taken. And what might surprise you, oftentimes the person that is driving an inappropriate return to play decision is actually the parent. And the
Sure.
athlete, they might just be a junior high kid and he, she, or they is just simply trying to figure it out. They don't know what's wrong. They know their knee hurts. The coach is saying, can you get him back in? But normally they don't say put him back in, but that does happen.
Right.
And then oftentimes I remember taking care of a person, I think he was a ninth grade football player in Estherville, Iowa, that absolutely had a sports related concussion. There was no way I was putting him back in. His mother came down out of the stands and says, Dr. Moreau, you have to put so and so back in. And I said, he's not going back in. He's got a head injury and a concussion. And she said, if you don't put him back in, we're not going to win this game. And I was
Yeah.
frankly dumbfounded. I thought, here's your son. You've just been told he has a head injury, and you're asking the doctor to put your son back in a junior high game to win? That's
But
not uncommon.
I think that goes back to what you said earlier, that the top priority needs to be the well-being of the athlete. And
Always.
I think that, yeah, and I'm hearing you say is sometimes that's forgotten by many. That's your responsibility to do what's in the best interest of your patient. I would imagine there are times when the doctor is fighting a battle on their own in that
I,
regard.
that's really important for the doctors to understand. Are you willing to put
Right.
this position that you so dearly love, that you wanted for so long, on the line for the health of one athlete? I
Yeah.
hope the answer is yes, because you need to be the shield of reason between a win at all costs attitude and the health of that athlete that you're overseeing. You need to be ready to be fired if that's what it
Mm.
takes to protect that person. If you're ever in a situation, doctors, where there's something really rotten happening, a win at all costs, where you say the person shouldn't play and they're playing anyway, finish the contest, because you don't know who else might be hurt. And then I would strongly urge you to reconsider if that's an environment that you should be in.
Yeah. Yeah, interesting. I can see where being a chiropractor for a sports team or for athletes, it's more than just the cool hanging out on the sidelines during a game. There's a lot to this, and potentially some very difficult decisions that need to be made. So I can see that. A couple questions that I've gotten are from our attendees today. One is around, there's a lot of groups out there within the chiropractic profession, say, that do offer resources and education and networking to doctors that want to make this part of their practice. And I'm not looking for an endorsement on any one over the other, but are there any good organizations that our listeners could check out if they're interested in more information in this area?
I think there's many good meaning organizations. I disclose that I'm the president of the American Chiropractic Board of Sports Physicians, so I clearly have a bias towards CCSPs and sports diplomates, but it doesn't mean that you have to have that to be a good
Sure.
doctor of chiropractic in a sporting environment. The National Football League has a group. I don't know too much about them, but I know some of the doctors on it, and I like them. The ACA Sports Council is a group. Your own state association may have a group. I think there's so many different groups, and don't forget your alma mater. They might have
Sure.
some
Yeah.
sports programming. There's masters in sports. There's all different kinds of learning opportunities that can be tailored for you regardless of where you live, whether it's in Alaska or whether it's in Manhattan. There's different opportunities that you can engage in. And in addition to that, consider looking outside the chiropractic profession. If you see that there's some kind of a sports related healthcare seminar, whether it's from certified athletic trainers or whatever it might be, maybe at a local hospital, maybe you could go attend that and just simply start your networking. And so I think there's many different organizations, and I feel like every single one of them has good intent for doctors of chiropractic within the United States to be able to expand their knowledge in the field of sports chiropractic.
Okay. Another one relates to performance enhancing drugs. So this question is, first of all, when this happens, especially with the Olympics, it's big news. Right? It's everybody hears about it. How common is this? And does the chiropractor have any role with, I don't know, turning in the athlete, or what's the chiropractor's role in all this? So I don't know
Well,
if you've got
I
anything
do.
on performance enhancing drugs.
I actually do. It's really interesting for me. If you're traveling at the high level, all the athletes are eligible for random drug testing. And
Okay.
it would not be surprising at all if you were with Team USA and maybe you're in Beijing and somebody wants to come and test a bobsledder. The team doesn't normally send that athlete unescorted to the doping.
Okay.
You very well, as a healthcare provider, may go with them and observe how the samples collected, different types of stuff like that. But in addition to that, one of the questions was how often? Really
Yeah.
rare for Team USA, really rare. When I was there, I think that our positive findings on anti-doping was 0.3%. Team USA competes clean, and that's why we're not going to win in some events. And by the way, at that time, the most common thing that our athletes tested positive for was marijuana.
Oh,
And marijuana is not actually a performance enhancing drug.
I think it
I
was
don't,
be the opposite.
yeah, we wouldn't really want to be working with an archer that's got
Mhm.
a bow and arrow and their influence. But here's another one. I am aware of a doctor of chiropractic who gave an elite athlete, like a really elite athlete, a supplement, a nutritional supplement. And the supplement was contaminated with a metabolite of a steroid. So
Ah,
the athlete is 100% responsible for what's in their body. If it got in there by accident or not, tough luck. And
yeah.
so the athlete was tested, was positive for a steroid related metabolite and was excluded. They didn't get to go to the Olympic Games because of that. And they had a
Oh,
2-year ban in sport performance, which ended their career.
right. I would think a 2-year ban that, for a lot of athletes that just ends it.
Oh, it certainly does. And so if you're
Mhm.
working with elite athletes that are in what's called a registered testing pool, I really would recommend you don't do nutraceuticals. Use whole foods instead, but try really avoid the nutraceuticals. There are some, I call it nutraceuticals, meaning vitamins, herbs,
Sure.
whatever. But there are some certifications of nutritional supplements that demonstrate that they are safe for athletes in testing pools to use because they have a scientific assay and there's a specific label that goes on that supplement. But I would really say be extremely careful. Just because you can buy it at a major store, Walmart, Target, whatever, it doesn't mean your athlete can take it. Even things like common cold remedies that contain ephedra or something like that, you can't give it to them. So my advice would be extremely careful about anything that isn't from a whole food type of a
Yeah.
perspective to treat your patient.
Yeah. Thank you for all of this. This is a really interesting conversation. We'll go ahead and start wrapping up. I just have a few other questions for you personally. First of all, what's your most memorable Olympic moment?
I have a lot of them.
I'm sure you
Uh,
do. I'm sure you do.
I think that probably maybe one of my most outward looking moments was Michael Phelps asked me along with other colleagues, Kevin Rendell and Dustin Nabhan, to come back to the warm-up pool before his last swim as an Olympian. I
Oh,
really didn't want to go. I felt like I needed to work in the clinic and there were still people competing, but he was pretty adamant that he wanted us there. And so Dustin, Kevin, and I went. And I would recommend that as the doctor, you don't seek pictures. I think maybe it's just me, but I think that detracts from the athlete's performance. The doctors never won a medal. The athletes win the medals. And so I just was going to go and just say, I thank you for representing the United States of America. I really appreciate everything you've done. And that was just to say thanks. He asked for a photo, and he asked, the
right.
only photo I saw him specifically ask for was with him and his three chiropractors. And there was a bunch of people chomping at the bit to get their photo taken. But when I was there, the only one I saw before his final races of an Olympian was with himself and some doctors of chiropractic that looked after him. Just want to be crystal clear. Michael Phelps is a champion because he's Michael Phelps. He's not a champion because anything we did. But nevertheless, I think that's something that touched me. And
Yeah.
then one that I won't name any athlete about because it has to do with an injury was something that affected me a different way. So that would be the victory. The defeat would be getting to know an athlete as a human being, who they really are as a person. They have a pie that makes them who they are. Part of the pie is the athleticism, but it's not the complete pie.
Right.
And knowing an athlete who took their own life
Mm,
because of mental health problems associated with
yeah.
sport participation, these amazing human beings, and to actually know that person not as a figure on TV, but as a human being, where they're from, if they have a dog, all these other stuff. And that's the flip side.
Yeah.
And so back in the day, Kurt Gowdy used to say, the joy of victory and the agony of defeat. There's the joy of pretty much everything in life, right?
Right.
And then there's also the downside. And so I really want the doctors to make sure that they are true crusaders for their patients,
Yeah.
that they are willing to take the bullet to protect their patient who is under the win at all costs approach.
Yeah.
Probably
Well, I
not what
think
you were thinking, but kind of
yeah,
a
no,
downer.
that's great. Thank you. And that kind of gives me an idea for a future webinar on mental health issues with athletes, because that's a huge issue as well.
It really
And
is.
something that chiropractors are seeing on the front lines. But I do think that that's a topic for another time. That seems like a big one. One more question. What will you be watching this weekend on the Winter Olympics from Beijing?
Wow. To be honest with you, I'm a pretty much watch them all.
Okay.
And I love the little bios to hear those personal stories, but I love cheering for the underdog.
Yeah.
And I just want to see those people. They come from all over the United States and
Hmm.
Canada and whatever country they come from. But just to watch the spirit of competition between the athletes, I can watch things where there isn't even somebody from Team USA involved. I must admit, I really like it when our women beat Team Canada in ice hockey, but I won't be talking about that this year. However, that's a very spirited hockey match.
I'm sure it is.
Rats.
Yeah, for me, it's going to be the couples ice skating. We
Oh,
have
yeah.
an athlete from Cedar Rapids, Iowa, that's competing. So,
Well, how
uh,
fantastic.
very excited to watch that. So,
Very
well,
cool.
Dr. Moreau, thank you so much for taking time with us. This has been a really interesting discussion. I appreciate your willingness to share with our audience. Before we go, I'd like to remind our listeners of our resources page on ncmic.com. You can also keep up to date with new resources from NCMIC by following us on Facebook, Twitter, LinkedIn, and Instagram. Once again, thank you for listening. Have a great afternoon.
Bye, everyone. Go Team USA.
Thank you.